Hi, I'm Georgianne Arnold, a professor of pediatrics from University of Pittsburgh and Children's Hospital Pittsburgh, and I'm here to answer some of your questions about fatty acid oxidation disorders. So one of the first questions is, when was the first fatty acid oxidation disorder diagnosed? The answer was actually about 1972, a disorder called carnitine palmitoyltransferase type 2. So how are they currently diagnosed? Many of the more common are diagnosed on newborn screening. However, not all of them, including one of the first disorders, CPT2. Some of the patients are diagnosed based on developing symptoms. These symptoms can include muscle disorders, low blood sugar, enlarged liver, and other things. And there are tests called acylcarnitine, organic acids, DNA testing, and others. So fatty acid oxidation disorders were added to the newborn screen. I believe Massachusetts in the United States was the first state who started a pilot program in 1999. Now, newborn screening is run by states. It's not run by the federal government. So it took a while for other states to pick up. But now all states in the U.S. and territories screen for the more common fatty acid oxidation disorders. So does newborn screening test for all types of fatty acid oxidation defect? And unfortunately, the answer is no. Most of the common defects are tested for, but not every defect is tested for on the newborn screen. For some, you have to build up enough of the abnormal metabolites, which you don't have a chance to do yet, and some just don't work out for newborn screening. Do all states include fatty acid oxidation disorders on their newborn screen? Yes, at this time they do. How does newborn screening work? How long does it take to get results? Well, when babies are born, at 24 to 48 hours, they prick the baby's heel and put some drops of blood on a card. That card is sent to a laboratory that's determined by individual states. In most states, the state actually runs the laboratory. There's also a private company that does newborn screening. So the laboratory does the testing on the blood spots and calls the result out if it's abnormal, depending on your state law, to the physician, to the hospital, and to the metabolic center. Generally, you have to wait till the baby is old enough to have built up enough abnormal metabolites to be detectable. So we don't recommend screening before 24 hours, and many places would prefer 48. So you have to wait a couple of days to do the screen. Then it has to be mailed to the laboratory. So the quickest we usually get results is about 5 days of age. In some places, it's longer. How accurate is a newborn screen? Well, every state runs their own program differently, but in general, most states report on 3 levels. It's either positive, it's concerning, but not an emergency, in which case they ask for a second screening sample, or it's concerning and the metabolic center, the family, and the physician are notified immediately. So overall, the positive predictive value of an abnormal newborn screen is less than 10%, and most of the second samples that are requested do indeed come back normal. However, for an emergency phone call, an emergency visit, the positive predictive value is higher. It's not 100% because newborn screening is a screening test. It's not a diagnostic test. It can't pick up 100% of cases, but we hope it picks up almost all of the cases. And newborn screening is a screening test. It's not a diagnostic test. So we try to pick up as many cases as we can without torturing families with false positive results. but unfortunately, it's not infallible. So, what about someone who's past the age of newborn screening or who wasn't detected in their newborn screen? How are they diagnosed beyond that for children and adults? Generally, at that point, you're diagnosed by symptoms, and symptoms can vary: low blood sugar, muscle disorders, and there are metabolic tests and genetic tests that can be done. So, in general, you would be referred to a center to do diagnostic testing.